Go ahead.
Hello, everybody. I'm Dr. Rashmi Niphadkar from Oasis Fertility, Pune Center, Wakad. Welcome to today's Facebook Live session. Today's session is about a very interesting topic. It is about uterine environment and its success in IVF. So, when we talk about IVF, US patients and we as doctors, the end goal is only one, that is to give you a healthy pregnancy and to have a healthy baby in hand. Now, in order to have a healthy end result, we need two critical factors. One is the quality of the embryo that you produce. The embryo is produced 50% because of the sperms and 50% because of the egg quality. So, the embryo you're producing is of critical importance. The second factor that is important is the quality of the uterine environment. Now, when I talk about the uterine environment, what I mean is the endometrial lining or the innermost layer of your uterine cavity. Variations in this endometrium or the uterine environment is a leading cause of failure in IVF, right? In order to have a pregnancy, what we need is implantation. Now, implantation, as I said, depends on the quality of embryo and the quality of uterine environment. When I talk about environment, I'm talking about the endometrial quality. I'm talking about the physical environment of the uterus, and I'm talking about the chemical balance of the uterine environment. So these are two separate things. The physical environment is how is your uterine cavity? Does it have any indentations? Is the cavity receptive to have an implantation of the embryo that we are putting in? Does it have any polyps inside? Does it have a fibroid in the myometrium, indenting in your endometrial cavity? So, all these are physical factors which may come in the process of implantation. Two things can happen. One, there might be implantation failure if there's a physical problem. Secondly, implantation may happen, but you may have a miscarriage later on as well due to these physical factors. So, a very critical factor in determining is we need to rule out whether the physical environment of your uterine cavity is good or not. Now, how can we do that? In a couple of ways. One is with the help of 3D sonography. So, with it's a very common diagnostic modality, simple and easy to use, and with it we can demarcate your endometrial cavity physically, and we can find out whether something is indenting in this cavity, whether there are any polyps, fibroids. How is the shape of the uterine cavity? This is also of critical importance. If we find anything in this physical environment, we can do a diagnostic hysteroscopy for you. That is, put in a camera into your uterine cavity and put in water and watch actually what is happening in your cavity. And we have corrective measures in place if there is any problem. So if there is a septum, we can resect it or cut it. If there are polyps, we can remove it. If there are fibroids, we can remove it hysteroscopically as well. So there are corrective measures that we need to do for this before we put in your embryos in the cavity. So the one is the physical environment of the uterus. Second, and also very important, is the chemical environment of your uterus or the microenvironment of the uterus, as I like to call it. Now, how does your endometrial lining grow? It is with the help of two hormones. One is estrogen, and second is progesterone. Even in your natural cycle, when your menses come, your endometrial lining is growth first by estrogen that we get, and secondly, progesterone comes into the picture, and that makes your cavity susceptible for implantation. So, even in the process of IVF, we like to give you first estrogen, grow your endometrial lining to an adequate level in thickness, improve the blood flow going to your endometrial cavity. And then, when we know that it's adequately grown, the blood flow is good, all the environment is good, we give progesterone, which makes it susceptible for implantation. So, two very important hormones when it comes to uterine environment are estrogen and progesterone. Now, how we do it is with the help of hormone therapy. We give estrogen first and then progesterone and then transfer. Sometimes we like to do it via natural cycle transfer. That means we are trying to grow your eggs. These eggs which grow will give you estrogen and then we'll give you progesterone and then transfer. So this is something what we call as natural cycle FET. So in both ways, the modality is the same. We want estrogen, progesterone, and then a transfer. That's how we like to make the uterine environment susceptible for implantation. Now, there are some other diagnostic modalities to know the chemical environment of your uterus. For example, I'm talking about ERA, ALICE, EMMA. Now, these are the tests for individualization of your transfer. So, as I said even before, what we need for a successful implantation is that your window of implantation of the endometrium needs to be correct. That is, adequate estrogen needs to act on it, and adequate progesterone at the adequate time needs to be added. Suppose your window of implantation is shifted in any way, we need to know it, and that we can do via the test of ERA, or endometrial receptivity assay. Here, what we like to do is take a biopsy from your uterus and subject it to testing. And we have a personalized report for your ERA, and then we like to plan your transfer likewise. So this is a very individualized and personalized embryo transfer, or PET, like we like to call. Some of the other tests to know your chemical environment is Alice and Emma. Now, Alice is a test that is done in case where we suscept chronic endometritis. So, when we want to rule out whether there is inflammation in your uterine lining, we like to do Alice test. And Emma is the test done when we want to know the uterine microbiome. So endometrial microbiome metagenomic analysis is something we like to do when we want to know how your microbiome of the uterus is. Just like your intestine has a specific microbiome, or the gut microbiome, even your uterus has a specific microbiome. And if the levels of that microbiome are disrupted, then also you may have an unsuccessful IVF cycle. So these are the tests we like to do when we want to know the chemical or the micro environment of your uterus. So in a nutshell, there is a physical environment and there is a chemical balance that we need to keep inside your uterus. And that is how your uterine environment is monitored during the IVF cycle. So that's it about uterine environment and the success in IVF. If there are any more questions, I'd love to take it. You can also call our fertility helpline to know more about embryo transfers and the uterine environment if you're having specific issues with regards to implantation or with regards to recurrent miscarriage. These are the cases when we like to delve more into the uterine environment. So, yeah, that's it for today. So, okay, so we have a question. What is a good uterine lining for IVF? So we have specific cutoffs to define uterine lining. How we like to measure the uterine lining is via a transvaginal sonography, and we can measure it in thickness. And so the minimum lining that we like to have is the least of 7 mm. Um, of course, some women have a tendency of having thin endometrial lining, and then we can work. There are different ways where we can counter that. In women who have averagely, they grow a good uterine lining, the minimum lining is 7 mm. So, one factor is the lining, the thickness of the uterine lining. The second factor is what is the blood flow that is going to your uterus, the lining. So we have different zones that we demarcate, and we like to see if the blood flow is reaching a specific zone. So both the factors we can demarcate on sonography. So that's how we judge whether your uterine lining is good and it's ready for embryo transfer or not. What is the uterine thickness for IVF success? So basically, what we like to define uterine success as uterine thickness for IVF success as the minimum of 7 mm. Uh, if your uterine thickness is less than 7 mm, the chance of a successful transfer goes low. So, but that is the minimum. Do have a good range of 7 to around 12 mm that we like to keep your uterine thickness as. How can I help my embryo attach to the uterus? So there is, as I told you, we want a good uterine lining. We want a minimum of at least 7 mm. We want the blood flow going there in at least zone 3. So we know that your embryo can attach or implant in this uterus. Of course, if your embryos are by itself of good quality or good grading, if they are day 5 embryos, that is, they are blastocysts, the chance of them attaching to the uterus also goes high. Another thing you can do is try and use embryo glue. That also might increase the chance of your embryo attaching to the uterus. How can I make my uterus stronger for implantation? Okay, so stronger for implantation, you may try to improve your blood flow that is going to the uterus. You can try and find out various asanas or yogasanas that you can do, which will help open up the blood flow to your uterus. The more regular your cycles are, the better your lining develops, the better your menses are. Your uterus is generally stronger for implantation. On our side, we do try to keep a good uterine thickness and good blood flow. We do give you estrogen and progesterone, as I said before in the presentation, to make it more stronger for implantation. So that's it for today. Thank you very much for logging in. Do call our fertility helplines for any more questions on the same topic, or you can take a direct appointment for the same. Thank you so much.